Hi, I'm Simon Wade. I'm a student of physical therapy at Nova Southeastern University. Today I'm going to be taking a video. Jensen, do I have your permission to take a video, do some exercise together and share this with my classmates?
Yes.
Perfect. So we're doing a case study today. Jensen is representing Mr. Avery. He's a 60-year-old male that complains of right knee pain, osteoarthritis, and from our measurements we determined that he had lacking 3 degrees of full knee extension on the right side. He had 115 degrees of knee flexion, which is 20 degrees shy of AAOS norms. And then he also manually muscle tested as a 3+ in knee extension as well as knee flexion on the right leg, so we have some weakness there. Today we're going to go over 4 things to address those issues. First thing I'm going to show him is 2 different exercises for the weakness in the knee flexors and the knee extensors. Then I'm going to show him a manual stretch that I'm going to demonstrate on him. And lastly, I'm going to give him a take-home self-stretch he can do to address his lack of range of motion in knee flexion and knee extension. So to start, I will demonstrate the exercises we're going to do. We're going to start with a leg curl with a TheraBand. Mr. Avery, can I have you put your leg in there? Perfect. All right. Now what I'd like you to do is stabilize your leg here. You can use 2 hands. Good. And then I want you to bring your heel back towards you. Hold it for a 2 count and then come back nice and slow, okay? Now let's do that. And since our goal here is to improve strength, we're going to focus on a rep range of about 6 to 8 reps. So good. Hold back, nice and slow. Very good. 6. Okay, good. Very good. Did you understand what we did here?
Yes.
Okay. Can you explain it to me just to make sure?
I use a TheraBand.
Okay.
I put her on my foot and I do curls.
Perfect. No pain or discomfort, right?
No, to strengthen my hamstring.
Okay, great. So that was our first exercise we're going to do. The next exercise we're going to do, I will have you sit on the edge of the table for me, please, Mr. Avery. Thank you. All right, next we're going to do a TheraBand leg extension. Perfect. And now I might need you to slide a little further forward. Good. Same thing, I'd like you to, with your hands, stabilize here. Good posture, which is important. And now I want you to lift your leg up as far as you can go, hold it, and come back nice and slow, okay? Using control on the way back. Same thing, we're gonna do that 6 to 8 times, okay? Good. Very good. Another thing we could do to make sure we have a horizontal femur here is we could roll a towel up and put it under the edge of his leg, so at home you can do that. Perfect. Very good. Good. All right. Now just to make sure you understood here, when you get home, can you explain to me what you're going to be doing and how many times?
I put the band around my foot,
Okay.
and I do leg extensions about 6 to 8 times.
Perfect.
And I can put a towel underneath my leg.
Very good.
Straight.
Perfect. So my patient understood both of those. We're going to do those 2 to 3 sets of the 6 to 8 reps, okay? And then we can do that most days of the week, all right? So these are our 2 exercises we're going to do. Next, I'm going to demonstrate a manual stretch, and we will address the patient's lack of knee flexion. We had 115 degrees. Can I have you lie on your stomach for me, please, Mr. Avery? Perfect. And so the involved limb was the right leg, so for the purpose of the video, I'm going to reach across the table, but if I was doing this in a clinic, I would walk around to the other side. So it's important that I stabilize at the pelvis here to make sure that we're not over extending the lower back, and I'm going to move the knee through the range of motion. Let me know when you feel some discomfort, please, Mr. Avery.
Right there.
Okay, so I'm going to go just to the limit of the patient's comfort. We're going to hold this for 15 seconds. If you need to stop, let me know, okay? 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and relax. Very good. We're going to do this 4 times to get a therapeutic dose of 60 seconds total stretching here. So let's go one more time. Good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Good. Aiming to stretch a little bit further each time if we can, working on that range of motion. Are you comfortable, Mr. Avery? No pain?
Not yet.
Okay. Let's go a 3rd time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Right there.
Very good. Let's take a breath and let's go one more time, okay? And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Very good. So we've done 60 seconds total of stretching his quads here, which is going to help address his lack of range of motion and knee flexion. Can you repeat back to me just to make sure you understood what's going on here? Well, this was a manual test, so I don't think he's not even doing this one at home. Next, I'm going to have you actually sit for me with your legs running down the table. Perfect, just like that. Hands supporting themselves, so we've got good posture. We're doing the right leg again, and we're going to address now his lack of knee extension. So I'm going to put either a towel, or in this case, a pillow, underneath the end here, just proximal to the ankle. Now, Mr. Avery, what I'd like you to do is press down into your leg until you feel the stretch in the back of your leg. Let's make sure we sit upright though and maintain good posture. Very good. And I want you to press down for 15 seconds for me if you can tolerate, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Go ahead and relax. We're going to do that 4 times total, okay? Just to make sure, I know you understood, can you tell me how many times we're doing that?
Doing this 4 times for 15 seconds.
Very good. Okay, great. That's going to help address his issue of the lacking 3 degrees of full leg extension. So to recap, we did a TheraBand leg curl to strengthen his hamstrings and his knee flexors. We did a TheraBand leg extension to strengthen his quads, knee extensors. Then we did a manual stretch for his quads, working through knee flexion, and a self-stretch you could take home, working on knee extension from a long sit. Thank you.